Good afternoon. Welcome to our 3-minute research presentations webinar. I am your host today, Judy Street. Before we start the session, I would like to pay my respects to the traditional owners of the land on which we are meeting today. The Heart Foundation acknowledges the traditional owners and custodians of country throughout Australia and their continuing connection to land, waters and community. We pay our respects to them and their cultures and elders past, present and future. A couple of housekeeping notes. Your microphones are muted, but you can communicate with us via the Q&A box on the bottom of your screen. If you have a question throughout the webinar, please type it into the Q&A box and we will try to answer it during the discussion time. Please note the webinar is being recorded and we will share the recording with you in the coming weeks. The research program team here at the Heart Foundation are excited to present this webinar today as part of our exclusive content for members of our alumni program. Our alumni program is in place for all currently and previously funded researchers and investigator teams to come together to network and learn with the potential to collaborate on the next big research breakthrough. Being able to promote your research projects, outcomes and impact is important to the Heart Foundation. We engage with donors and to the public to promote the work of the foundation, and being able to talk about your research is a big part of that. Today we are going to hear from our development and marketing teams who are going to tell you of their experience in communicating research. From our development team, we have Amanda McMahon, who is a development manager with the Heart Foundation. Her role is to connect people who have a personal affinity with our mission and high capacity to give, with personalised opportunities to achieve their own vision for philanthropy through the Heart Foundation. And from our marketing team, we have Kate Scratton, who is a marketing manager here at the Heart Foundation. She works with a powerhouse marketing team to showcase research and our researchers drive fundraising efforts and behaviour changes campaigns. Kate has a background in developing international advertising campaigns across Australasia and Europe, and with a focus on long-term brand building and behaviour change initiatives. We are also joined by our research operations manager, Amanda Shea, who will be introducing our 3 winning videos. Amanda manages the delivery of the Heart Foundation funding portfolio and the alumni program. Now here is Amanda McMahon.
Thank you, Judy, and it's great to be with you all today to share with you the importance of promoting research to donors. It really is a privilege to do the work that I do to connect people who care about a better future for heart health and to connect them with your work. So it's a real pleasure to join you today. There are 3 key things I'd love to share with you today. The first is about how we promote research to donors. The second point is around how your videos, like some of the terrific examples that we're seeing today, play a role in that. And thirdly, and I feel most importantly, is why it's important to hear from you when sharing these stories. So if I can go back to my very first point, how we do it, I think it's important to give you a little bit of context first about the way we work with philanthropists at the Heart Foundation. Our first goal is to really build a relationship with these people and seek to understand what it is that they would most like to achieve with their philanthropy through the Heart Foundation. So for example, what is their personal connection to our mission? Perhaps they have lived experience or they love someone who does. And when they think about supporting research, we really try to draw out what type of research are they most interested in supporting, and really importantly, who are the people that they would most like to create a better future for. These things are important because it helps us frame how they can be at the centre of making your high impact research happen. It also guides how we promote the research in a way that helps them understand how they can make that vision a reality. So for example, we can share stories of some of the outcomes and tremendous impact that has been achieved through many heart researchers who have received funding from the Heart Foundation. We can also introduce them to researchers like yourselves and also people with lived experience. and even invite them to join us for a forum or event, which is very powerful to make the work real for them. Specifically, and this is something I'd really like you to take away with you today, is that when we promote research, in terms of how we do that, we also speak to how the Heart Foundation funding specifically supports this work. So one question you might like to keep in mind if you're ever joining us to communicate with donors is, what does this particular funding mean for you as the researcher and for the success of your project, and what unique impact does this funding create? The reason that is important in terms of how we do it is because many of our donors can and do give very generously to the many amazing research institutes that we have in this country. And so we need to make it really clear for them about the specific impact they have by giving through the Heart Foundation. So that's a little bit about how we do it. I'll move on now in terms of how your videos play a role. So videos like the amazing examples we'll see today tell a really compelling story, and they speak to the problem statement and what it means for people, and how the research that you lead will address those challenges towards a better outcome. Videos really provide another tool for us to tell the story in lay terms. So to make a common language, make it easy to understand, so that our donors can understand how they are improving and saving lives when they support your work. Ultimately, people give to people. So when they think about your work through the lens of the people it impacts, that's when it's most powerful. In terms of why is it important to hear your story? To that, I would say that in all of the experience I've had in working with our donors, people want to support the individual researchers as well as the beneficiaries of your work. Your passion and expertise for the work that you do is really compelling, and it makes it very real for donors in terms of the people behind the work that they're helping to fund. And if we think about it through that lens, you are the best person to communicate your research, and you're the best person to speak really authentically about why you've been inspired to do this work and what the funding would mean for you. So for example, you might like to think about Heart Foundation research funding through the lens of, does it help you focus your time on your project? Does it help you expedite your work? Does something like a Future Leader Fellowship open doors that other funding perhaps wouldn't do as well? This is really critical, again, because it helps to bring the work back to you as a person, and that really helps donors feel that they're having an impact beyond the project itself.
Change pace for a moment now and have a look at some of these amazing videos that we've just been talking about. Over the past 2 months, we have asked alumni members with currently funded research projects to submit a 3-minute video describing their research, any outcomes achieved, and the expected impact of the project. Today, we are excited to announce our 3 winners who will each receive $1,000 that can be used towards translational activities such as professional development training, creating journal articles, or even attending a research conference. However, it doesn't end there. We want you, our audience, to tell us your favorite video. Think about how well each video and the researcher has explained their research, how well they use their time to discuss their overview, outcomes, potential outcomes, and of course, any extra points for creativity. Our lucky audience choice winner will also receive an additional $1,000. Voting will take place after the 3 videos have been shown. Okay, so today's first video was submitted by 2019 health professional scholar Laura Yeates from the University of Sydney. This research project looks at caring for families affected by sudden cardiac death of a young relative.
Sudden cardiac death is a devastating complication of many genetic heart diseases. The type of scenarios I'm talking about are the child who goes to school and doesn't come home, the worker who goes to work and has a cardiac arrest and cannot be revived. When we look at what causes sudden cardiac death, a significant proportion are due to a genetic heart disease. This is not caused by anything the person's done, but caused by a fault in a gene that you're born with. My name's Laura Yeates and I'm a genetic counsellor and PhD candidate from the Centre for Population Genomics at the Garvan and the University of Sydney. But what about the psychological impact on the surviving family? Our previous research has shown this is significant and lifelong, and that 1 in 2 family members suffer from symptoms of prolonged grief and post-traumatic stress, and that those who witness the death or perform CPR are 4 to 5 times more likely to have these symptoms. And this is on average 6 years after the death. So this is not something these families just get over. When we asked our families what they needed as part of their medical care, they ranked medical information and psychological support as needs that were both highly endorsed but yet remained unmet in a significant proportion of families. I'm currently in the process of designing and evaluating a support program to help these families. This will comprise a website and some online sessions where families can connect with one another and receive the information they need. The website provides information in written and video format and links families to the online sessions. Online sessions are a series of 4 sessions held over video conferencing software to allow easy access for those all around Australia. They'll cover 4 different topics around grief and loss. The online sessions build on information provided in the website and link participants back to their resources. We also hope to raise awareness of sudden death in our community. It's important as Australians that we know about our heart health, we know about our family history, and we know how to do CPR. It is our hope that this program will fill an important gap in the care of these families affected by sudden cardiac death and raise an important awareness of the impact of sudden cardiac death in our community.
That's a great video. Thanks, Laura. Next up, we have 2018 health professional scholar and Baker Institute researcher, Dr. Elizabeth Paratz, whose research is focused on optimizing the genetic and forensic analysis of sudden cardiac death.
My research is based on young, sudden cardiac arrest. A cardiac arrest is when the heart stops, suddenly. It affects 750 young Victorians each year, and it's fatal in 90%. A cardiac arrest can affect anyone, of any age. It can be caused by almost any heart disease. But in fact, you don't need to have any known history of heart disease to have a cardiac arrest. And in fact, most people don't. My research is based on cardiac arrest in young people, where it's much more mysterious why a cardiac arrest might happen. In about 1/3 of cases, we do not find any reason, even after performing all the possible tests we can. We have constructed Australia's first registry that draws data from ambulance, hospital, and forensic services to paint the most detailed picture of cardiac arrest that we can. We offer families affected by young cardiac arrest state-of-the-art cardiac assessments to identify other family members at risk. We provide psychological support and further research involvement. We track the number of cardiac arrests and their causes to better prevent future arrests. Our registry is helping us to answer all the following really important questions. How many people have cardiac arrest with no symptoms beforehand? Why do some people with heart conditions have cardiac arrests and others do not? Are some Australians at more risk than others? Can cutting-edge cardiac tests be used in people after they have died? What is the impact of losing all these young people to cardiac arrest on the Australian economy? And can we retrieve information from devices like pacemakers and smartwatches after a cardiac arrest to tell us what happened? My PhD, supported by the Heart Foundation, is really clinically important. We've set up a resource that's going to help answer questions that really matter to us as cardiologists looking after affected families. We provide a new level of support for families dealing with sudden cardiac arrest, and we hope to keep explaining what is currently unexplained. Thank you.
Another fantastic video. And our final winning video today is from 2018 postdoctoral fellow, Dr. Stephanie Partridge from the University of Sydney. Her research project is the prevention of obesity in young people using text messages.
How we eat today is strongly linked to how we ate during our teenage years. For today's teenagers, over 40% of their diet is made up of junk food. We blame them. Young people are constantly fed junk food advertising because big food companies know how to influence them. But young people make up 1/4 of the world's population. So why aren't we harnessing the influence of young people to improve research that impacts their lives? My name is Stephanie Partridge, and my research aims to improve the diets of young people by collaborating with them. Right now, we're focusing on 2 major problems. Firstly, online food delivery is growing in popularity with young people. With the help of big celebrities like Kim Kardashian, it's no wonder Uber Eats is the most popular app. I've led a multi-country cross-sectional study to understand the impacts of Uber Eats on the diets of young people, and the results aren't good. 3/4 of the most popular food outlets were unhealthy. So instead of walking up to the local takeaway shop, so much more junk food is accessible to them with just a few clicks. Secondly, we have few scalable public health strategies to help young people improve their diet. This is deeply inequitable and will impact the health of the next generation. Our solution? In collaboration with young people, we've created a new program called Text Bites. It's a novel, fun and innovative text message program. Despite all the fancy technology, text messages are still the most popular form of communication for young people. And they're equitable. Over 90% of young people own a mobile phone, and text messages are easy to receive and free to receive. We're recruiting 150 adolescents in a randomised controlled trial to see if this program will improve their diet behaviours as well as other lifestyle behaviours. Taken together, my research advocates for big food companies to take responsibility for the health of the next generation, and to help young people now overcome this growing and intense influence of big food companies by working together to create accessible and scalable public health strategies. How they eat today will impact the rest of their lives.
So I am sure you are all as impressed as we are with these 3 videos. You can really see what great examples they are of being able to promote research to our general community. We will now hand over to Kate Scrutton, who is going to talk to us a little bit about marketing and promoting your research.
Perfect. Thanks, Amanda. And thank you everyone for having me here as well today. I mean, it's such a treat that we get to connect anyway, but particularly that someone from marketing that we get to connect with the amazing researcher community that we have as part of the Heart Foundation. Obviously, the research that you all do is the foundation for all the activity that we run as part of the Heart Foundation. And, you know, our aim as a marketing department is to showcase research and researchers through as many marketing channels as possible. And look, one of the main reasons for that is that it is our key donation driver. So showcasing research in a way that's easy to understand and shows impact increases donations and therefore increases the opportunity for future research as well. It's exactly what Amanda said. So we just want to make sure that from all areas of the Heart Foundation, we're showcasing research in the best way possible. And there's sort of 4 ways that we currently do that. So we showcase research through our brand campaigns, through our appeals, and there's 5 key appeals throughout the year: Christmas tax, a beautiful bespoke little research appeal opportunity, which we call Give with Heart Day, and then 2 donor care events throughout the year. And they're really the events where we want to go hard on the impact. Then we have obviously research community communications. So not just with this group of alumni and current researchers, but to the wider research network. We want to make sure that we're continually showcasing the research that you guys do in the best way possible. And then the fourth one is sort of business as usual. It just means that everywhere we possibly can in our day-to-day communications that we're showcasing research stories. And look, there's so many channels that this kind of comes to life through. There's film, you know, our big brand campaigns do run across TV and YouTube, social, of course, media. I know there's lots of you on the call that myself and my colleagues have hit up for spokesperson opportunities, as well as editorial opportunities across the web, across our owned website, but through programmatic native sponsored content as well. That's a really big one that we find is really successful, sort of, I guess, advertorial messages that have been authored by researchers. Through DM and EDM. And I think the interesting thing that we do here is we speak to each of our donor bases in a slightly different way. You know, some of our more high value donors are really interested in the detail around research projects. And then perhaps like a single giving donor or a once a year giver might sort of want a more high level take on what a research project entails, and then a sort of real life case study that it can impact as well. So we really make sure we kind of chop and change it in the most appropriate way possible. And then we've just started doing webinars in line with each of our appeals. We think it's so important that, as Amanda was saying, that the research really comes from you guys, and you have an opportunity to connect directly with our donors, and they can ask questions and understand more. I mean, I don't come from a health background, but particularly all of the videos I've seen today, they're so helpful to really put research in layperson's terms so you can understand the impact your donation is having. So there's a whole heap of channels, and what I wanted to do is just kind of give you a bit of a glimpse of what we've done over the last 12 months and how all those channels, how this sort of tangibly comes to life, and who we've showcased. So this is a lot of the Hand on Heart campaign from last year, and Give with Heart Day assets. And, you know, that kind of went across the board, reached over 20 million people, this campaign as a whole. Then we had Christmas in sort of the back end of last year, and really featuring those webinars has been extremely successful for us. And here you can see that same campaign, but just a slightly different audience. So it's more focused on kind of the clinical detail, I suppose, and making sure that's really clear for the higher value donors. And then January Donor Care. This is an opportunity for us to come back in and say, look who you supported at Christmas and look what they're up to now. Here's a bit of an update. I think that kind of continued dialogue is so important, as well as heroing other research projects that are, you know, topically relevant as well. I think that's absolutely very important that we connect in again. And again, some more donor care assets. I just wanted to show you a little bit of what happens on our website. We try to make those experiences as interactive as possible, because of course, if you're getting direct mail through your letterbox, or a call, or an EDM, or you see an ad online, the ultimate donation destination, I guess, is our website. So we try and include links to as much, so donors can kind of dive in as much as they would like to, in the best way possible. So we've got lots of learnings around that. And again, pushing all these appeals out through social as well is super important. Tax is one of our biggest campaigns throughout the year. And you can see here that we're showcasing quite a few elements of research. In the past, we would showcase one researcher, one bit of research in each appeal. But we found that really broadening that story and including all kinds of research, makes us appeal to more donors, and just shows the breadth and depth of what the Heart Foundation supports, giving sort of just more credibility to us and more reasons to donate. And again, a sort of a more deep dive into particular research projects. And then we have Donor Care, which is live at the moment, which again is focused on impact and following up on case studies that we have looked at in the past. So donors feel, again, invested. And then, of course, Always On. We're always connecting with you guys as part of our alumni network, but also we have a really strong heart health network. So that's an opportunity for us to connect with GPs, with dietitians, with cardiologists. And it's also something that, you know, we can help you guys utilize that network as well for whatever you might need. And social media is a big one. I know that my colleagues have kind of talked to this group in the past around social, but there's so many ways that we can hero your stories for different audiences across different channels, but making the most of awareness days, and weeks is a great link to make your piece of research particularly relevant to, say, Diabetes Week or Men's Health Week. And then, of course, spotlighting funding opportunities is a big part of what we do, and showcasing the success of the past, as well as just profiling you guys. You're so important to us. Putting a face to research is absolutely a priority. So we love videos like what we've seen through this initiative to be able to kind of bring you and your projects to the forefront, as well as any breakthrough research. So honestly, this kind of content does incredibly well. Our audience is always so interested to understand what we've been a part of. That is really the next step in sort of heart disease prevention and treatment. As well as collaborating with our research partners. I know so many of you have so many kind of different institutes and funding. We're absolutely open to sort of showcasing how we are collectively funding your work, absolutely. So I think in summary, we just want to keep heroing you and everything you're doing. Videos like we've seen today helps people like me better understand your work and identify how to showcase it, where those areas are that we can kind of create bespoke content for different audiences. So let's keep the dialogue going. I mean, Amanda and Farisha do an amazing job of understanding your work and sharing it with us. But anytime there's updates, information, anything you think might be relevant to share with us, please absolutely come forward, because it's really a focus for us. Thanks. So just while I stop sharing, aside from marketing, now let's talk about all the amazing videos that we've seen today. So we wanted to have a bit of a Q&A session and open the floor to everyone on the call today to ask any questions about the particular research projects that we've seen today. And Amanda McMahon, I think you might have a question to start us off, kick things off, but please feel free to comment in the chat. I think Farisha is probably the best way to do it. Any questions you might have. Amanda, do you want to kick things off?
Great. Thank you, Kate. And let me just say, again, how wonderful it was to have the opportunity to see those videos today. If I could start with you, Laura, I do want to say first, it was really great in your video to see you talking about your personal passion for the work. That really came through. And I also loved, from a donor perspective, that you mentioned the consultation you did with families. I know that when I have conversations with donors, one of the things that really is top of mind for them is, well, how do you know from the people that need help that this particular thing is what they need? So that came through really strongly in your video. I wanted to ask you today, Laura, how would you explain, what is the impact, or what could be the impact if this particular issue is not addressed around better mental health care for families?
Oh, such a great question. I mean, I think we all know mental health is important, but the impact that particularly a sudden death in a young person in your family has on you and your family is just, it's huge. It's, we speak to families where they're having flashbacks and post-traumatic stress disorder symptoms of the event that needs intervention from a clinical psychologist. So without that, that person still needs to look after the rest of the members of their family. They need to go to work and pay their mortgage and do all those things. If we don't address the psychological impact of sudden cardiac death, then we can't help these families in, I guess, going through their grief. This is not something they'll ever get over. You don't get over the sudden death of a family member, but this is about giving people the support so that they can deal with all these issues that are coming up and try and find a new normal.
Thank you, Laura.
Nice. And I've seen one come through the Q&A box here, which is great. This is one for you, Stephanie. What kind of challenges do you face around recruiting young people, and how do you overcome those?
Yeah, so recruiting young people has been one of the biggest challenges that I've faced in my research, particularly teenagers. So young people are not coming into contact often with healthcare settings. They're coming into contact very rarely, so they can't often not be referred from a GP or a health practitioner. So we've had to go broader and try and recruit on social media and through high schools and avenues like that. And then we've had the added challenge of COVID that has come on as well. So it's been extremely, I guess, challenging to recruit them and sort of compete on that online space and get your study seen and wanting young people to be able to engage with it. Yeah, so social media has been a big one, but obviously opportunities, that any opportunity we take where we can be in an audience with young people, we take it. We presented at a student medical Australian medical conference, which did a high school presentation. So we were there presenting to a big audience of young people.
Nice, nice. I have another question for you, Stephanie, which
Sure.
What is your sort of intention around the content of the kind of text messages that you'll be sending? Are you thinking tips and tricks, recipes that are sort of clinically proven to be nutritionally appropriate?
Yeah. So we designed the full message bank with young people. I had some funding where I employed a young person who was my research assistant. So together we worked to develop the message bank, and then the full message bank was then reviewed by another sample of young people from different backgrounds and different gender balance and all those kind of things. So all of the messages were rated and approved by them, as well as, but the content is around nutrition, physical activity, as well as mental health and general behaviours that we know are important to young people. So education, climate change, and those kind of factors. And all of the messages are positive. There's no negative messages, and it's all around creating that positive engagement with positive behaviours.
Nice. It's great that it sort of covers a broad range of things that are all kind of around positive behaviours, not just one sort of specific stream. Nice. Amanda, do you have any? I think we've got some lovely questions for Liz. Actually, if it's okay, I might ask you. You ask yours first, Amanda.
Right, thanks, Kate. Elizabeth, I wanted to say with yours that what really stood out for me in your video, it was just excellent use of sound and people imagery. I think that if I were a donor, I would be looking at that and having a very clear picture of the everyday moments and people that are at stake when we think about sudden cardiac arrest. So well done on that front. A question that I had for you is I'd love to learn from you what inspired you to become a researcher and work in this field.
Well, thank you for the comments on the video. I co-opted my whole family in lockdown 5 out of boredom to be actors in it. So I think it's sort of just really a natural thing when you're a clinician, an extension. I think it actually mirrors a bit what was said earlier about the Heart Foundation being a big organisation, how good it is when you've got a personal face. It's kind of the opposite when you're a clinician, that you see people interact with them on a very personal level and they share their stories, which are really memorable and meaningful, and particularly in a lot of cardiology, really impactful things. And you say, well, is this part of a bigger pattern, and what can be learned from these experiences people are having? And it's just a natural extension from that. So for our registry, for example, as Laura has said, one sudden cardiac death is a huge tragedy that can just rip a family apart and create a whole legacy of concerns and issues. And we want to be proactive in addressing that. But how many families per year are affected? What patterns can we learn from sort of the bigger pictures, and how can we then also use that to try and get patterns and work on prevention?
On that, around sort of understanding patterns, in your video you mentioned tapping into smartwatch data, which is super interesting. How will you go about kind of finding and understanding that?
So we've got several projects. The first one, which is written up and submitted, is looking at people who have implanted devices like pacemakers, defibrillators, or loop recorders monitoring their heart rhythm. And we've looked at 15 years of data through our Forensic Institute here in Victoria, and what's the findings have been. So were there device malfunctions? Were there things that could have been picked up and acted on prior to the event? So that's sort of one for people who already have a device that's implanted in them. And then we have a more, I guess, prospective study where patients who attend our clinics where there's been a sudden cardiac death and they were wearing a smartwatch around the time. And this was actually initiated by the families who said, we've got all this data and we're just going to delete it, and will there be any research value? And we had no idea, because there isn't really an equivalent project. And so essentially the families have been opting in, and we collect that. And at the moment it's very small numbers, but because we're a registry of young sudden cardiac arrest, more and more people were wearing smartwatches at the time of events. So ultimately we will have, I guess, kind of a sub-registry of all this data and can then compare it to healthy people who are wearing smartwatches who have not had an event, and try and look for patterns there.
Interesting, nice. Is there any more questions coming through the floor from any of our audience members? I've got another one for you, Laura, around, so online service is absolutely a great initiative. What's your delivery plan? Like, will you be reliant on health professionals to promote, or will you hope to see organisations like us be involved in delivering this message?
Yeah, all of the above. So in speaking to the families that I see, so I'm a cardiac genetic counsellor in Sydney. And so when we talk to families about how they find our genetic heart disease clinic, lots of them talk about having trouble finding information. So some families will come to us through a Google search. And so hopefully my website will come at the top once it's done, but also direct referral from the Department of Forensic Medicine institutes themselves. And so we've had in the first part of my study in working out what sort of support we needed involved co-design with our stakeholders. So families were a really key part of that, but we also had involvement from departments of forensic medicine and some of the other genetic heart disease clinics around the country. So I hope everyone, cardiologists, GPs, yeah, hope it goes viral.
I mean, it's a great forum to do shout outs like that. Anyone, get involved as soon as it's kind of ready to go. Absolutely. Nice. And I don't think there's any other questions coming through. One last call.
I've got a question for Stephanie, Kate, if I could. I thought with your video, Stephanie, what really stood out for me from a donor perspective was the way you were able to explain how the world has changed to create a problem that hasn't otherwise existed before. And I think that when I think about the next generation of donors, so the children of the baby boomers who currently make up most of our high net worth donors, it's a really exciting time to talk to donors about challenges that are new that they can be involved in at this early stage. So that was fantastic. My question for you was, I'd love to understand, is your project, is it an Australian or a global first? Do you know if there's other similar work being done in that space?
Thank you so much for your kind comments. So we did a systematic review looking at these type of interventions globally, and really we didn't find very many that were operating. So a lot of studies use, smartphones, obviously, which are really, up and coming and things like that. But they do use a lot of data for young people, and particularly young people from low socioeconomic areas. They may not have, a big data plan on their phone. So if you're using a program that requires all of that data, that may not be a priority for them. So we really want to stick to something that's really simple and scalable, which is text messages. And we still know that that's the most popular form of communication for young people. And then looking across, we've just completed a review looking across the New South Wales landscape around what's available for young people within this space, and there really isn't anything. So a lot of interventions focus on children, and then young people, our adolescents, are often just this forgotten population in the middle, even within our healthcare system. So it's basically a child or an adult focused system, and then we've got this gap in the middle. Even a lot of services for young people around obesity or things like that end at 16 years. And then there's this gap from 16 to 17. And where do young people go? And then they're forced to go online and, try and navigate that big, wide digital space where there is just a ginormous amount of information and misinformation. So trying to really cut through that space and create something that's unique to them and is freely accessible and something they can easily sign up and get benefit from.
I have another question, Stephanie. How will you measure the engagement of, I guess, can you measure opens? Is there questions that people have to reply to, little quizzes? I don't know.
Yep, so 25% of the messages request a reply. So it could be a short quiz, like, how many, one of the things I think is how many bathtubs of water does it take to make a soft drink bottle? So that's something around like the climate change aspect that is interesting to them. And then they can respond back with what they think the answer is, and they'll get a response. So we can measure engagement that way. And as well, we've got a full process evaluation built into our randomized control trial. So we're doing interviews at the end of the study to really understand how young people engaged with it. They can also do health counselling calls with me during the program. So they get 6 over the program. So we can measure how many take part in that and all of those kind of aspects as well. But also the system is also able to tell us how many messages are delivered and read.
Amazing. It's so interesting for obviously the kind of advocacy side of things post, but even for us at the Heart Foundation to understand how then we can learn from your research later on to help implement our food and nutrition programs in a better way, even our physical exercise. So it's really, really fascinating. Definitely want to stay posted on that one for sure. Cool. Nice. And then I think I'm handing back over to Amanda.
Yeah, thank you so much. That was some really great insight from all 3 of our winners today. What we're going to do is pop the poll back up because I don't think everyone had a chance to vote when it was up before. So we're going to pop that up quickly again to see if anyone else has any votes they want to add in. There you go. And whilst we're just doing that, I just wanted to thank everyone who did submit a video in the first place. We got some really great videos. This is the 2nd year we have run this competition, and we just find that it is so great for our program, the organisation, our donors to have this content to continue to share, whether it be on social media or on our website. It's really, really, really good to sort of get these everyday languaged videos out there. So we do thank everyone that participated, and you might be inspired by what you've seen today. And whilst this is the competition finishing today, it doesn't mean that researchers can't continue to submit videos to us. We really do love getting videos all the time. When we get new awards handed out, we do also ask for all of our new awardees to submit a short video that we can use on social media to promote their research. So we'll continue to do that and continue to work with researchers to keep getting this great content. So I think that might be where we're at with the poll. I will just get my trusty colleagues to send me through what we have in the way of our audience choice. And I am very excited to announce that our audience choice today is Stephanie Partridge. So congratulations, Stephanie. I will also just at this point, because we do have a bit of extra time, Stephanie, did you have anything else you wanted to add about your research project, or anything else you wanted to tell your alumni, fellow alumni members about?
Oh, no, thank you so much. That's wonderful. Or anything that gets the attention drawn to adolescents and prevention and diet. It's one of the biggest burdens of disease globally. And young people make up, as I mentioned in my video, 1/4 of the world's population. So they're going to be a big generation moving forward. So anything that helps their health move forward will be wonderful. And any attention we can draw to that.
Excellent. And just in that last moment for everybody, Laura, did you have anything else you would like to add about your research?
Oh, look, I just want to say a huge thank you to the Heart Foundation. So I'm one of the healthcare professional PhD scholarships, and I've been wanting to do something more in this space for years, but without your scholarship, I wouldn't have been able to take the time out from full-time work to be able to do it. So I'm just really grateful and yeah, really excited to share what I've been up to with everyone in this space, and stay tuned.
Excellent. And Liz, final words from yourself?
I don't think I can add much to what Laura said, but again, thanks to the Heart Foundation very much for their involvement, not just in funding and facilitating research, but then having a real interest in the outcomes of it as well. It's really heartening to have that kind of interest in what we're doing.
Excellent. Thank you so much. Well, as you can see, the sun has come out in Melbourne today, and I'm getting a face full of sun now, so we're probably wrapping up at a great time. I will hand over to Judy to wrap things up, but firstly, we did have another message, a question that came through about whether these will be shared on socials, and yes, these videos will be shared over the next couple of days. I think even this afternoon we're getting some of the videos out on social media, so keep an eye out.
Well, that concludes the webinar for today. We've been so happy to share these amazing videos with you today. We hope you learned some ideas around how to film your own impact video, and we look forward to seeing them. The research program would like to thank Amanda and Kate for joining us today. We also thank our 3 winners, Elizabeth, Stephanie and Laura. Our next alumni exclusive webinar is scheduled for September the 8th, where we will be exploring advocacy and how the research community can raise more awareness and funding for cardiovascular research. How to register details will be provided in our next alumni newsletter. We look forward to your continued engagement with our alumni program. Have a wonderful day.